How does hormone treatment for men and women impact on their sexual life?
Okay, hormone treatment for men in a younger age group is not very commonly found. Generally speaking, it would be younger men affected by prostate cancer that might receive hormone treatment. Some men who are treated for testicular cancer, or those who are treated with an intensive type of chemotherapy or bone marrow transplantation, stem cell transplantation for leukemias and lymphomas, they may find that their testosterone levels are adversely affected by those systemic treatments when they are quite intensive. And so if they get a drop in the male hormone, that can adversely affect their desire for sex. It could also, again, make it more difficult for them to get and keep an erection, and it can also have an adverse effect on their ability to climax or have an orgasm.
Okay. How do people manage this loss of sexual interest that can be caused by cancer and its treatment?
I think in the short term, quite often, much of sexual desire is self-regulating and self-resolving. So as the person goes through their cancer treatment, comes out the other side of it, begins to feel physically better and also emotionally more resilient and getting back to all the normal things that they're doing post-cancer treatment, then their desire for sex often tends to return along with that. Okay. If the loss of sexual desire is directly related to reduced hormone levels, then it may be that there's a need for them to have some sort of testosterone replacement therapy on the male side. Okay. It may be that that's necessary in order to help them get their desire back, but also to help them with an adequate erectile function. Okay. On the female side, again, any treatments that adversely affect ovarian function, so that could be surgery removing the ovaries, it could be radiotherapy to the pelvis that adversely affects the production of estrogen, or again, it could be a woman who's given an anti-estrogen treatment for breast cancer. Again, they will find that it adversely affects their desire. It can also create other symptoms of treatment-induced menopause. So women will have hot flushes, they will feel fatigued, they might feel quite emotionally labile and cry quite easily. And that, coupled with fatigue, means that they again won't find their desire coming back spontaneously. So the willingness of our colleagues in the medical team to give hormone replacement therapy largely depends on whether or not it will have an adverse effect on cell growth in terms of cancer regrowth. So women who've got estrogen receptor positive breast cancers would tend not to be enabled to have hormone replacement, whereas with the exception of men after a diagnosis of prostate cancer, generally speaking, giving them testosterone back is fine.